Many thanks for joining us here on Gist Nigeria from the BBC and Channels Television. And here on the program, we keep an eye on all the stories making the rounds on social media. I am Wali Fakile. Let's start with our top story. Now, being a patient in any Nigerian public hospital today is perhaps one of the scariest things to happen to anyone. Resident doctors have been on strike for weeks now, and it doesn't seem that there is any end in sight just yet. Government and the doctors are still in talks. But while they talk, Nigerians are subjected to untold sufferings, and those needing specialist services are left to their fate. Why are they on strike? What is being done to address the issue? How soon can this be resolved? Gist Nigeria's Ajoke Ulotse has more.
A once bustling hospital premises lays bare. Hospital wards previously housing sick patients, now filled with empty beds. A costly industrial action in Nigeria continues to cripple an already struggling health sector, leaving thousands of sick people without medical help. On the 2nd of August 2021, the National Association of Resident Doctors, an umbrella body of medical doctors in residency, downed tools. The second strike in 2021 alone, and this time indefinitely. The association claims that for years, its members suffered government neglect.
A lot of things are preventing us from discharging our duties very well. And we may outline it as job satisfaction and welfare of our members.
The impact of the strike is severe, with millions of Nigerians unable to access quality and affordable care. On the 28th of June, 29-year-old Emmanuel Ejim was rushed to the National Hospital, Abuja, in critical condition. Only the intervention of then working doctors saved his life from a ruptured abdomen. Emmanuel tells me that since the commencement of the strike, he has been unable to receive follow-up care for his now improving condition.
Before the strike, doctors instructed them, since he has looked at the surface of the wound, that they should dress this wound once daily. But since they were on strike, I, as the patient, am the one that is dressing the wound.
Just like Emmanuel, 34-year-old Faith Agayo found herself in the hospital after a car accident. Her husband, the staff of the hospital, helped her assess the treatment she desperately needed.
Other patients have been coming in, they walk them back.
Not everyone is lucky enough to know someone in the hospital. Sadly, diseases continue to ravage, waiting for no one. Before now, thousands of people trooped to the Lagos University Teaching Hospital, LUTH, one of Nigeria's foremost tertiary health institutions for specialist care. Weeks of strike by resident doctors in the country means patients now have to explore alternative options for their health care, sometimes paying through their noses because hospitals like this one run skeletal services.
Government is also trying to do its best to satisfy doctors, nurses, other healthcare professions, and workers in other spheres of life within the limits of available budgets. So it's a balance that we must seek.
Student doctors and consultants try to fill the gap, but that is barely enough. Before now, Nigeria suffered an acute shortage of doctors. With a population of more than 200 million people, the World Health Organization's Global Health Workforce Statistics reports that the number of doctors in the country has continued to dwindle since 2009. The number of physicians per 1,000 people was reported at 0.4 in 2018. Poor conditions of service, poor pay, lack of adequate training and hazard allowance are a few of the factors that has led to the brain drain in Nigeria's health sector, leaving thousands of doctors seeking greener pastures outside the country. Chukwuemeka Okolie manned one of the isolation centers in Lagos during the first wave of the coronavirus pandemic. Today, he's a doctor in the United Kingdom and tells me doctors in Nigeria work under very harsh conditions.
When I did my internship, right, back some years ago, the interns, we call house officers, we were owed salaries for 9 to 10 months before we were paid.
Living in a struggling economy can be hard. The Resident Doctors Association claims that some of its members remain unpaid despite working under hazardous conditions amidst rising inflation.
You have salaries of doctors that have worked for months. In some states, they have worked for 16 months. In some states, for 7, 8 months without salaries. And you have, even in the federal employment in several hospitals, many doctors, young doctors have been employed and they have worked from 4 to 7 months without pay.
Meanwhile, a government licensed recruiting agency based in Nigeria's capital, Abuja, has commenced interviews for doctors to leave Nigeria and work in Saudi Arabia. Convincing doctors to stay in a place they claim their welfare is not prioritized has become increasingly difficult for the Resident Doctors Association.
In just last year to this year, over 2,000 have left for Saudi Arabia. And within the last 2 days, over 5,000 had taken an interview, and I'm assuring you in the following few days, you will see them, they will leave the country. So the resident doctors are saying, no, we have to reverse this brain drain, because at the end of the day, the poor Nigerians that cannot travel out for foreign medical tourism, that cannot patronize their private facilities, they will not have access to Medicare.
But what becomes of patients whose hope of healing lies with doctors in public hospitals?
You don't expect a resident doctor that has not had salary for 3 months to treat you well when you are sick. It is actually a disservice to you.
The federal government has approached the court seeking an injunction to stop the strike. It has also invoked the no work, no pay policy against striking doctors. But how much impact would this have on these consistent industrial actions, despite a recent meeting between government and the striking doctors?
By taking the doctors that you are going to court, you are aggravating what's already on ground.
Every one of us in the system needs to show that commitment. The commitment to building, or if you like, rebuilding.
How can lasting solutions be found to improving the welfare of doctors and health workers in Nigeria?
We need to have a government or leaders who are serious, and are really committed.
A lot of the things they talked about, they are systemic. They are systemic. And if something is systemic, I mean, you have to look at the institutions that make up that system. So we need to rebuild institutions within that system.
The phrase "health is wealth" is popular for a reason. It speaks to the essence of a healthy population and its contribution to the wealth of a republic. Experts insist that only a healthy nation can be deemed prosperous. And to prosper, health must be given its rightful place and proper attention paid to the doctors charged with making us healthy. Ajoke Hulotse, Gist Nigeria.
So many issues on the plate there. But while will government back out on an agreement it's freely reached with the doctors and other issues raised in the report, Ajoke sits down with Nigeria's Minister of State for Health, Olorunimbe Mamora.
The resident doctors have been on strike for about a month now. So why has it become increasingly difficult for government to find a solution?
It's not as if deliberate efforts have not been put in place all along. Don't forget that you have a situation where you have agencies of government that are involved, and there has to be a kind of collaboration.
On the part of the resident doctors, they claim that this is about over the last 1 year they've gone on strike about 3-4 times, and they claim that they are not seeing sincerity on the part of the federal government as to the memorandum of understanding they've gone into with the government. Is this process not taking quite a while for this problem to be fixed?
I think the doctors, they need to exercise greater patience in these issues. Government has shown a lot of commitment. I told you, even at the highest level of government.
So when a doctor isn't getting paid over months in an economy that is struggling, How much of patience do you expect that kind of doctor to exhibit?
Well, I'm happy that you also you picked that. That is the issue of in an economy that is not. It's not as if money is even stuck somewhere. It's also based on funds available at a given point in time.
But in a situation where school fees is not waiting, it's not, it's fast tracked. You go to school, people have kids in school, they have to pay school fees, they have to feed their families, and all these bills are fast tracked. And government is saying, it's a slow process.
Look, I understand, but don't forget that this is not something that cuts across. No, let's get that clear. I mean, for the sake of fairness, you see, because when these things are pushed out there into the media space, there's a lot of misunderstanding, as if it's a global, that is across board, as if it's everybody that has on. It is not true. We need to get that clear. But that is the picture. Of course, well, I don't blame whoever is doing that. It's part of, playing the game and getting sympathy. To take the issue of even the medical residency training thing, which is it's an act of the National Assembly of the Parliament. But of course, that's one of the issues again. The doctors seeking for domestication. We can only appeal to the states because we're not the ones who is going to give it the states to pay. But the federal institutions, we were ready to pay. But and some states are already paying. So if some states are not paying, is that a reason now to have a strike action covering the entire country?
So how do we find a lasting solution to this problem in a way that everybody wins?
Health workers, generally, they need a conducive environment to ply their trade, whether as doctors, whether as nurses, whether as medical laboratory scientists. Everybody needs a conducive environment. Everybody. But we are talking of people that we have entrusted our lives onto their hands now. So, I'm saying that health care delivery should be given the pride of place, particularly in terms of funding, because everything starts from funding. I'm not saying everything is about just throwing money, no, but funding is critical. It is critical to having the healthcare delivery that we all wish for.
Hopefully, permanent solutions, not temporary fixes, will be found soonest to ease the pains of Nigerians needing medical care. Still to come here on Gist Nigeria from the BBC and Channels Television. Nigerian innovator transforms electronic waste to solar lanterns powering hospitals and households. How, you may ask? We bring you that story and more after the break. Do stay with us.